Hello, everyone. Thank you for joining Adult CSL Online Learning. I'm Dr. Hernandez Smith. In this video, we are going to be reading Chapter 2, Premature Menopause, from the Menopause Guidebook, 9th edition. If you're interested in purchasing the Menopause Guidebook, you can order it at www.menopause.org for $10. Before we begin, we want to thank our subscribers for supporting this channel. Chapter 2, Premature Menopause. The normal age range of menopause is between 40 and 58 years. However, about 1 in 100 women will go through menopause before age 40. This is known as premature menopause. There are several reasons why premature menopause occurs, and sometimes the exact reason is unknown. When it does occur, examination by a healthcare provider is recommended. Women who go through premature menopause may face emotional challenges and struggles with fertility. They may also have specific health risks that can be addressed. Induced menopause occurs when a medical treatment such as surgery, chemotherapy, or radiation removes or seriously damages both ovaries. The reason for the medical treatment may affect whether hormone therapy will be recommended. Surgery. When both ovaries are surgically removed, menopause results. Cancer is a common reason for this surgery. Removing both ovaries may be done to treat ovarian cancer or to prevent breast and ovarian cancer in women who are considered to be high at risk. Sometimes the ovaries are removed, often along with the uterus, hysterectomy to treat non-cancerous conditions such as endometriosis or pelvic inflammatory disease. In these cases, the decision to remove both ovaries depends on the severity of the disease and the age of the woman. It's a decision that shouldn't be taken lightly. A woman should consider all of her options before consenting to have both ovaries removed. When possible, retaining a single healthy ovary or even part of an ovary will provide enough hormones to prevent premature menopause. Unlike the typical gradual menopause transition, menopause occurs immediately when the ovaries are removed. Because of the abrupt hormone shift, women who experience surgical menopause often have more severe symptoms, such as intense hot flashes and vaginal dryness. For some medical conditions, a hysterectomy may be done while one or both ovaries are left in the woman's body. Even though this does not result in menopause, menstrual bleeding and fertility and estrogen levels will still fluctuate as menopause approaches, which may result in menopause symptoms. However, because periods are no longer present, the approach and onset of menopause can be more difficult to detect. Even with the ovaries remaining, a hysterectomy may result in menopause, occurring 2 to 3 years earlier than it would have without a hysterectomy. Chemotherapy. Chemotherapy is a powerful drug therapy to treat various types of cancer. It may be used along with surgery, radiation therapy, or both. It's designed to travel through the body and destroy cancer cells that may have spread beyond the original site of the cancer. Unfortunately, it may damage healthy cells as well as cancerous ones, including healthy cells of the ovaries. For some women who undergo chemotherapy, ovaries may no longer have healthy eggs or be able to produce hormones. Women aged older than 40 years are more likely to experience ovarian damage and infertility from chemotherapy. Chemotherapy can result in a range of adverse effects, including fatigue, nausea, vaginal dryness, and hair loss, all of which can resemble common menopause symptoms. This may make it difficult to determine whether the treatment or menopause is the cause. Radiation therapy. Radiation therapy uses high energy particles or waves to damage cancer cells and reduce their size, keep them from growing. It's a common cancer treatment and often used in combination with other therapies. But unlike chemotherapy, which exposes the entire body to anti cancer agents, radiation therapy affects only the area being treated. Because radiation therapy also can affect healthy cells, radiation therapy to the pelvic area may damage the ovaries and trigger menopause. However, the ovaries can be shielded in some cases. Lower doses of radiation may cause only temporary damage, and menstrual periods and fertility may return after a time. Primary ovarian insufficiency. Primary ovarian insufficiency, POI, is a condition in which younger women skip many periods in a row or have no periods at all. A blood test may report a high follicle stimulating hormone, FSH, level, which can be a sign of menopause, and a few eggs left in the ovaries. However, the release of an egg from the ovary, ovulation, may still occur on occasion, which means that pregnancy is still possible. Some women with POI experience typical menopause symptoms, whereas others do not. Some women resume normal periods at some point, and others do not. There are several known causes of POI, including certain genetic and autoimmune autoimmune disorders. Unfortunately, much is still unknown about this condition, which makes it difficult to predict what will happen. Women aged younger than 40 years who have missed 3 or more menstrual periods are advised to see their health care providers to differentiate whether this is caused by POI or whether another reason for menstrual dysfunction is at play. Because of the health and fertility implications, women with POI should discuss their concerns with their health care provider. Important topics include possible associated conditions, childbearing options, sexual health concerns, and psychological support. Hormone therapy is another consideration. It's recommended that most women with POI take hormones until the average age of menopause, roughly age 52, in order to offset the effects of the early loss of estrogen. Well, premature menopause affects health. In general, the onset of menopause brings about an increase in certain health risk factors, such as to the bone and heart. For women who go through menopause very early, these risks may be greater. With menopause, there is usually a short time of more rapid bone density loss, which is followed by slower but ongoing bone loss. In the case of premature menopause, this earlier loss of bone may lead to an earlier risk of bone fractures related to osteoporosis. Osteoporosis. For women with premature menopause, in addition to taking estrogen, it's especially important to engage in activities that encourage the preservation of bone density, including getting regular exercise and adequate amounts of calcium and vitamin D, mainly through the diet. It's common for healthcare providers to recommend regular bone density testing to monitor the progression of any bone thinning over time. Premature menopause also may increase the risk of heart disease later in life. This makes it important that in addition to taking estrogen, one should follow a heart healthy lifestyle with steps that include not smoking, reaching and maintaining a healthy weight, and being physically active. Certain dietary patterns, particularly those that promote adequate fruits, vegetables, and whole grains, have also been shown to make a difference in heart health. In addition to estrogen, many of these same lifestyle habits also have been shown to be beneficial to memory and help protect the brain against dementia. Because menopause appears to influence cognitive function, this is an important consideration for women who experience menopause at a younger age. Managing the emotional effects of premature menopause. Just as important as the physical aspects of premature menopause are the emotional ones. Premature menopause can cause distress to a woman's sense of self. For women who still want to have children, the effects may be particularly damaging. Premature menopause may increase concerns about body image, sexuality, fertility, and the perception of growing old prematurely. For women with POI, the diagnosis may be delayed, which can be frustrating. Women going through premature menopause also may need to cope with or continue treatment for the underlying condition that caused menopause to occur. For women with induced menopause, especially as a result of treatment for a serious or even life-threatening illness, a number of fears, a number of other fears and concerns may compound the challenges of premature menopause. These include pain and discomfort related to disease or treatment, anxiety over additional treatments, a sense of loss of control related to illness, treatments, hospitalizations, and adverse effects. Confusion over a lack of information. Confusion over a lack of information or a feeling of informed overload or a feeling of information overload. Frustration over a lack of support. Feeling unattractive because of changes from surgery. Embarrassment related to hair or skin changes caused by chemotherapy or radiation. Feelings of resentment or guilt. Apprehension about relationships, including sexual activity and intimacy. A feeling of uncertainty or hopelessness. Fear of not being cured or of death. Fear of disease coming back, reoccurrence. These feelings are normal when facing a serious health concern, but can be disabling. A therapist or a support group may help you find assistance and work through these concerns. But sometimes medications are appropriate to assist with low mood. Frequently asked questions. If I have premature menopause, can I still have children? Women with POI do sometimes ovulate and pregnancy can occur naturally, although the chance is low. For women with POI who desire children, there is increasing information and testing available about the number of remaining healthy eggs a woman has, her ovarian reserve, and how this relates to her chance of getting pregnant. Women should discuss their childbearing desires with their healthcare providers before undergoing any treatments that could damage their ovaries. Today, a number of options are available to help pregnancy still be possible, including harvesting eggs, freezing fertilized eggs or embryos for later use, or using an egg donor. For women having chemotherapy who wish to preserve fertility, an ovary suppressing drug may be one option. A woman's age, general health, or type of medical treatment, and the time and costs required for fertility treatments can determine which options are available. Can menstrual periods return if they've stopped after having chemotherapy or radiation therapy? It is possible that your periods may return after your ovaries have had time to recover after one of these therapies. However, the more time that passes without having a period, the less likely you are to have one again. Will chemotherapy or pelvic radiation limit my sexuality? It's difficult for a woman to feel sexual while being treated for cancer when she is preoccupied with her health and may not feel well. Weight gain, hair loss, and other physical changes that may occur with these therapies can damage a woman's body image making her feel less desirable and comfortable about intimacy. In addition, the therapy itself may have negative effects on the vaginal area, such as vaginal irritation may occur with some chemotherapy drugs. Many women are able to resume a satisfying sex life after cancer treatment. However, it may take close communication with your partner to adapt to any changes or new needs. If you experience vaginal dryness or discomfort with intercourse, you may find lubricants or other aids beneficial. Your healthcare provider may be able to recommend other measures, such as medication, pelvic floor physical therapy, or vaginal dilators for improving pain with intercourse. Thank you so much for watching. I hope you found this video helpful. I look forward to seeing you in the next one.